There are several advantages to working with PMA Health. The first is that instrumentation is provided by the company and allows the physicians and practice to choose between available instrumentation such as dedicated line source PET cameras as well as PET CT cameras. And secondly, my role as medical director is extremely important in this model. I'm involved in research with PET perfusion imaging as well as setting national standards. This translates into a complete awareness of the changes going on in the PET perfusion imaging world, and this translates into practical uses in each laboratory that chooses the PMA solution. As medical director for PMA, when a laboratory chooses to move in the direction of PET perfusion imaging, my job starts. I assist the laboratory in the choices of camera systems, as well as room size, room location, and management of the room in terms of radiation safety. This has to do not only with present but future nuclear cardiology products that can be used for PET perfusion imaging. Once the laboratory is established, my role shifts to that in assisting the laboratory with development of protocols, maintenance of high image quality on a daily basis, and establishing accreditation for the PET imaging program in that laboratory. This is done on a daily basis in which images can be submitted to me for review and potential change in protocols. In addition, the field of nuclear cardiology is changing. Therefore, one of my roles downstream will be that of assisting the laboratory when new products, new tracers, new pharmaceuticals become available and are implemented into a cardiac PET perfusion imaging program. I had the pleasure of working with a laboratory in Pennsylvania to establish their PET imaging program. This laboratory was the first in the private sector to establish PET perfusion imaging. I worked with them on image protocols as well as image quality and finally accreditation. My role in working with this laboratory was extensive. Approximately 1 week after the establishment of the program, I went to the site, worked with the physicians interpreting the images to assure that the image quality was excellent and that the interpretations were correct. Since the inception of this program, I have been involved with the image quality and protocol development on an almost daily basis. Furthermore, I've returned to the laboratory several times to provide education for the cardiologists in the practice as well as a referring group of physicians who attended a CME event. The CME event was extremely successful in providing important information to referring physicians with regards to the benefits of PET perfusion imaging.